Hello friends and welcome back to my channel. In this video we are going to talk about the compartment syndrome, hepatitis, Cephalhematoma, DVT or deep vein thrombosis, Salmonella and Salmonella triangle, and respiratory distress syndrome, poliomyelitis, chemical burn, and uterine fibroids. So let's start. So first is crush syndrome. So crush syndrome is also known as traumatic rhabdomyolysis or compartment syndrome, crush syndrome. So all of these are same things. So what is this, sir? This is a serious medical conditions that occurs when the muscle tissue is severely damaged due to prolonged pressure. For example, in the cases of accident, in the cases of earthquake, we can see the crush syndrome. What are the symptoms which are going to see in the patient, sir? Severe pain because of pressure, swelling, tenderness, decreased range of motion in the affected limb. What are the systemic symptoms? Dark tea colored unit because the muscle damage is there, since there is myoglobinuria. The muscle damage is there, so in the muscle cell will get wasted through the urine. So muscle weakness will be there, nausea and vomiting will be there, increased heart rate will be there because the patient is in tense, or the patient is in stress right now due to prolonged pressure, crushed, or some injury over there. Signs of renal failure, decreased lower output, and fluid retention, electrolyte imbalance. So the condition of the patient will be grave. What we are going to see in the patient, let's see the patient. So 42-year-old minor was freed after 12 hours under the rubble. He something got fallen over him. So the rubble, he was under the rubble. Both lower legs and feet are pale, no pulsation, peripheral vessels, no sensitivity, no passive movement in the joint. Hospital with the tourniquet applied both limbs. What urgent first aid to be provided to prevent myoglobinuria and acute kidney failure? So the patient's conditions are very grave. It is mentioned in the question that he was suffocated under the rubble for 12 hours. Like the mine, he's a miner, he was mining, so some big block got fall over him, the rubble got fall over him. So what emergency or urgent first aid we are going to do to the patient? So what we will do is, the best thing is, do not remove the tourniquet and amputate the limbs above the tourniquet. So unfortunately we have to, it's been 12 hours and unfortunately we have to amputate the limbs of the patient. So no need to remove the tourniquet, because it's not going to give you any benefit, so keep it there. So here is some diagram over there. So this is the tourniquet, and amputation site is this blue one. Red one is the tourniquet and blue is the amputation site. So amputate the limb above the tourniquet, because tourniquet removal will anyhow not going to help you in any case. So amputation will be the best treatment here. Let's go next. Next is hepatitis. So hepatitis is inflammation of liver caused by the viral infections. It can be also the result of toxins, alcohol abuse, or some autoimmune condition, or some medications which are causing reaction in the patient. So sir, what symptoms we are going to see in the patient? Jaundice, because it's the problem related to the liver, fatigue, abdominal pain, dark urine, pale or clay colored stools, loss of appetite, nausea, vomiting, fever, joint pain, which is termed as arthralgia, itchy skin. Weight loss can be there or cannot be there, so depends on the severity of the patient. However, it's not a typical or hallmark finding for the hepatitis. Swelling, ascites will be there, like in some fluid collection in the parts of the body. There is only one question in the croc exam. However, I wanted to tell you a little bit more about hepatitis. So hepatitis is the feco-oral route is the route of transmission for hepatitis A, and symptoms which we are going to see in the patient. There will be an incubation period for 45 days, and then there will be the prodromal period. There are 4 periods of hepatitis hepatitis. First is incubation period, then is prodromal period, third is icteric period, fourth is the recovery period. Do not have to remember for the croak exam, but you can remember the symptoms which I have written here. But just so you know that there are four periods of hepatitis. In some questions of hepatitis A, the question can say that on the fourth day the fever got reduced. So that you remember about this, that it is the case of hepatitis A when the question says to you that there was fever in the patient, and on the fourth day the fever got reduced and this new symptoms got developed. So there was the question I have seen there. So that was the case of hepatitis A. However, let's read the question which is given here. So 25-year-old had an abortion half a year ago, loss of appetite, weakness, arthralgia. 2 weeks later developed the dark urine and jaundice. Viral hepatitis is suspected. So what should be the marker of the hepatitis here? So you have to remember that the marker of hepatitis A, first of all, IgM indicates what we have talked in the video about the immunoglobulins. IgM is the recent marker, like the infection is recently happened. So what we are going to see in the patient will be antibodies to hepatitis B core antigen. This is HBC. So hepatitis B antibodies against the core antigen. So remember about it. In hepatitis B, antibodies against the core antigen. Sir, how you will treat hepatitis though? So first of all, how to diagnose it? So liver function test will be enough to diagnose it. Yeah. So in the cases of hepatitis, you can do liver function test, and or sometimes ALT, AST you can do. How will be the treatment? So the treatment is basically bed rest. You have to provide the bed rest to the patient, and you can give, in the cases of hepatitis A, you can give the diet like chicken diet, rabbit diet, toast, or hydration therapy. And in the cases of hepatitis B, so how you are going to diagnose hepatitis B? Sir, also the similar findings as hepatitis A. This is the only question which you have to remember. But if you want to know for the information, in hepatitis B, we are going to see the Carolese triad. So headache, rash, and arthralgia. Arthralgia is only mentioned here probably. Another things are no, headache is not given in the question. The same things actually in the hepatitis B cases, the intoxication gets worse, and diagnosis how you will do, sir, liver function test. So what you will see in the markers, sir, IgM to the core antigen plus HBC, the anti-hepatitis B. So treatment, bed rest, diet, hydration, sometimes antiviral therapy. So this is enough for hepatitis, I guess. Let's go next. Next is cephalhematoma. So what is cephalhematoma? So cephalhematoma is the collection of blood between the skull and periosteum, occurs as a result of trauma during the delivery. For example, traumatic delivery, prolonged labor, macrocephaly. Symptoms we are going to see: swelling. This doesn't cross the suture lane of the newborn head. Soft to touch, delayed onset. So let's see the question directly. Examination of the newborn girl detects the hemorrhage on the child's head. Hemorrhage is limited to the one cranial bone and doesn't pulsate, painless. And what condition has developed? Sir, the condition which has developed in this patient is cephalhematoma. You might have already know about this question, is too many times repeated in the test center. Next is deep vein thrombosis. So deep vein thrombosis or DVT is characterized by the formation of blood clots or thrombus in the deep veins, usually in the legs. So what happens with the patient is swelling in one arm, pain or tenderness, red or discolored skin over the affected area, warmth of the area, or due to any clot. So let's see the patient. So the patient says Tumor of the sigmoid colon and chronic thrombophlebitis of the deep veins of the right leg is scheduled for the surgery. So he is undergoing surgery. The optimal medicine for the prevention of deep vein thrombosis. So if we want to prevent the thrombosis, so prescribe the low molecular weight heparin to the patient since the patient is undergoing to the surgery. Next is Salmonella. So Salmonella or Salmonellosis. I have written only eggs over there because the question is about eggs. So this is an infection caused by the bacteria of genus Salmonella, resulting from the contaminated food or water. So the also the same root, the feco-oral route will be having. The Salmonella endarteritis species is typical for the inflammation of the stomach or intestine. Sir, what will be the symptoms in the patient? So symptom, the main thing which I want to highlight. Rest other symptoms you know about them: diarrhea, abdominal pain, nausea, vomit, headache, and muscle pain. So the main symptoms which you are going to see in the cases of Salmonella, that the pain, for this pain there is the abdominal pain triangle over there. So the pain triangle says, so triangle is the pain in the epigastric region, the pain in the umbilical or para-umbilical region, and the pain in the right cecum or right iliac region. So this is the triangle of Salmonella which you have to remember. Other things you may forget about it. However, how you are going to diagnose it. So for diagnosis of Salmonella, we are going to do a stool culture to identify Salmonella bacteria, blood culture to identify the systemic inflammation or typhoid fever, or to rule out the other things. So we will do the stool culture. And treatment should be fluid replacement, or let's say the oral rehydration therapy, and we are going to prescribe some antibiotics to the patients. For example, ciprofloxacin or azithromycin you can prescribe to the patient easily for the treatment for the salmonellosis. And yeah, this is it. What is the question saying? The frequent copious foamy stools without pathological admixtures, cramp like pain in the peri-umbilical region. You got the pain in the peri-umbilical region, one of the part of the Salmonella triangle. Rumbling of stomach, fever, catting, soft boiled duck egg. So the patient ate some egg, due to which he got some abdominal symptom or GI symptoms. So remember that Salmonella endarteritis is the species or genus from the Salmonella group which will cause the GI symptoms or inflammation of the stomach or inflammation of the intestine. So enough about Salmonella. Next is respiratory distress syndrome. So this is commonly seen in the newborns, or more commonly, let's say, the premature newborns. Particularly preterm infant due to insufficient surfactant in the lungs. So sir, what symptoms we are going to see in the newborn? However, the respiratory rate of the newborn in this corner, as it says, 30 to 60 per minute is the respiratory rate or normal rate of the newborn. What symptoms we are going to see in the question is symptoms after birth. So will be respiratory symptoms: grunting sounds during exhalation, rapid shallow breathing, nasal flaring with which is nostril widals during inhalation, because this is the case of respiratory distress syndrome that the patient is having RDS. Chest retraction as well, because the patient will not be able to breathe. He might have aspired the meconium in the uterine life. Intercostal or subcostal cyanosis, decreased air movement on auscultation. So let's see the baby's condition. The baby 30 weeks old, which is preterm here, 1100 gram, which is also low here. 3 hours after the birth, frequent apneas appeared, gasping type of breathing observed, heart rate is low, Silverman score is 9 point. Oxygen did not improve the child condition. What must the doctor do? Sir, do the positive pressure ventilation of the lungs. If you are supplying oxygen to the child and the patient condition or the newborn condition did not improve, so it means the problem was not with the oxygen saturation this time. So oxygen saturation will happen when the when the pathway or the tracheal way, or let's say the respiratory pathway is clear, right? So if we do a positive pressure ventilation of the lung, so positive pressure ventilation of the lung, so probably the patient's condition, we are expecting that they are going to improve. So next question is again the premature infant is there. So this was the case of respiratory distress syndrome. Next case is premature infant, again 27 weeks, irregular respiration, which are more than 30. So after birth, SpO2 is 70%, retraction of the areas on the chest, expiratory grounding are observed, cyanosis with the oxygen, crepitus in the basal segments, no data in the prevention of respiratory distress syndrome. So what is the treatment? Basically the question is asking about what is the treatment of the respiratory distress syndrome. So after you have done whatever you could do, so administer the surfactant, like positive pressure ventilation or whatever you want to do. So if you have done all of those emergency treatment or emergency managements according to the protocol, so what you will do now, so the treatment tactics in this case are in the cases of respiratory distress syndrome are administer the surfactant preparation intratracheally within the first 15 minutes after birth or before the newborn pass away. So this is I hope this is clear now. Next is poliomyelitis. So polio is a highly infectious viral disease caused by the poliovirus. Primarily affect the children, can lead to paralysis or even death. So most of the symptoms will be asymptomatic. However, if the symptoms are there, what they're gonna be? So non-paralytic polio and paralytic polio. Two types we have divided in polio. So paralytic and non-paralytic. So sir, in the non-paralytic, what we are going to see: fever, headache, nausea, sore throat. Sore throat is something good finding here. We can use as a hallmark. So muscle pain and stiffness. Sir, what is the symptoms with the paralytic polio? So paralytic polio, only 1% of the cases reports about the paralytic polio in the cases of nervous system. So sudden weakness, paralysis, loss of reflex, muscle pain, spasm, respiratory problem. If the breathing muscle is involved or if the breathing muscle got paralyzed, so there will be respiratory problem or permanent paralysis or some sorts of disabilities. So let's hear it from patients. The patient is 6-year-old, developed a scratchy sensation in the throat. So this is about highlighting about that sore throat or something. On the 4th day after the onset of the disease, the temperature normalized. So the patient thought that the condition is okay now, everything is fine now, but now the complaints of pain in the legs has appeared. So sir, just look at the profile of the question, how the virus of polio is transmitting from scratchy sensation of the throat to the leg part of or the paralytic part or the proceeding towards the paralysis of the patient. Child started limping. Limping is something like crawling, or the newborn, or let's say the child cannot walk properly, and dragging the left leg. Muscle tone and reflexes are decreased, and while the sensitivity is retained. So what happens in the cases of paralytic polio? Only the paralysis occurs. This is something hallmark finding related here, that in the cases of polio virus, the reflexes are decreased but the sensitivity still stay, because the case is of the paralysis, but the sensitivity will be still retained in the muscle. So this is the case of paralytic poliovirus. Next is chemical burn. Chemical burn occurs when the skin or eyes or the internal tissues and damage to the exposure to the toxic chemical. Our patient is a chemical plant worker. While working on an aggressive liquid, accidentally spilled on it. So you can read all the case history, but what will be the emergency aid? If some chemical burn is there, rinse the lesion under the running water. So I hope this is clear. How you can pause the video and read the whole case, that what the patient developed. Next is uterine fibroids. We have discussed it in the gyneco part as well, but let's just see this one question if it comes in the exam. Uterine fibroids, leiomyoma or myoma, all of these are same things. I have also included the photo in my first video, and in the reel or short portion of the YouTube you can check my photos related to the theoretical part. So this is the known cancerous growth that developed in or the uterus, in the uterus. What are the symptoms which we are going to see in the patient? Heavy menstrual bleeding, pelvic pain or pressure, frequent urination, constipation, lower back pain, pain during the sexual intercourse. This is something hallmark finding which you can use in the question. Enlarged abdomen. Our patient, actually this question seems to be a bit translation error with the question. But let's try to make some sense to it. This is a 48-year-old woman, this and this and this and this. So her health has been monitored by the gynec for uterine fibroids. So her cervix is cylindrical, clean, cervical opening is closed, body of the uterus is enlarged up to 9 to 10 weeks of pregnancy. Firm, mobile, painless appendages on the both sides. Parametry are free, fornices are deep, mucus discharge is being produced. Nothing really typical for the uterine fibroid is given in the question. Let's make some sense that when the question will give you the uterine fibroids in the question are given when, so go with the answer uterine fibroids. Her health were being monitored by the gynec for the uterine fibroid. So already suspect the diagnosis uterine fibroids. All right. However, you can relate the symptoms. This is it with this video, and I hope you are getting the points, the main key points which are highlighted by the examiner. So see you in the next video.